Hi, my name is Jen Christoffel, and this is a short tutorial on how to release the muscles around the front and back of the neck that tend to be a little problematic, especially during or after mat classes where it involves a lot of forward flexion. The important thing to remember that when you do torso flexion in mat classes, you should always be making sure that you bring your chin towards your throat slightly before you lift your head and chest up. So a little bit of work, just working on feeling the chin retraction ability of the neck will help you at first to feel the motion of the chin drawing into the throat. Now this action here actually helps to stabilize the neck before you lift your head. And a lot of people have a forward head position a little bit anyways, from either sitting at a desk or reading books a lot or watching Netflix or whatever. But what you'll want to make sure is that when you nod your chin, bring your chin to your throat, that you're not actually creating more of a problem of your head going forward. So just put your fingertip on your chin first and imagine that your head is a golf ball on top of a golf tee. And the head on the tee is going to slide back a little bit. So see how I'm just sliding my chin back, almost like my jaw is the drawer of a cash register and I'm drawing the chin back a little, and then the cash register drawer pulls forward or draws forward. Or like the golf ball is drawing back on the golf tee so that it's better centered, and then let it release forward where sometimes it tends to sit and it's not supposed to. So just remember, before you do a forward torso flexion, lifting your head and chest forward off on the mat, say like in the 100 or in the abdominal 5s, try to make a little bit of a chin retraction first so that the chin draws in towards the throat. Then you can lift your head and chest forward off from the mat. And actually this is a good thing to practice just during the day. If you start to feel tightness in the back of your neck around the occipitals, just doing a little chin retraction exercise. Very gentle, don't squeeze or tense anything. Just feel the head glide back, the skull glide back on the occiput. Okay, so that's the first thing to remember. Now some stretches to do that will help you maybe after your class are to stretch the SCMs and the scalenes. I'll also show a stretch for the upper traps. So first, just to stretch the SCMs, the sternocleidomastoids, the ones that kind of, if you lift your head up, they kind of bulge down here on your neck. What you're going to do is slightly side bend your head, and I like to put my arm around me. See how my fingers are around the other side of my body, and that helps to create a little bit of downwards resistance with that arm. And then what you're going to do is pretend you're gazing up at the stars. You're just going to turn your head gently and look up, and then you're going to look down a little bit and then come back up to center. And now we're going to tilt the head a little bit and gaze up at the other angle of stars, and then back down and up. And actually, as we go this direction, it's also stretching scalenes. Scalenes are those little muscles that attach into the ear that assist with breathing and get very tight on people when they lift their head. So this actually is a little bit more scalenes, and then release and come back up. And then if we tilt and look up at the stars the other direction, this is going to be more your SCM stretch or your sternocleidomastoid stretch, and then back up. But both of them are very, very good. So you're going to go ahead one more time and tilt, gaze up at the stars at that corner and back to center, and then side bend your head without leaning your torso and gaze up at the stars at that diagonal. So notice my head is tilting back slightly. And then you'll actually start to feel that stretch all the way down into here, and then back up and to center. Now to stretch the trapezius muscles, you're going to slowly tilt your head, and this is for upper trapezius, and then just gently put your hands on your head. Don't pull or push, just let the weight of your hand give you a little bit more of a stretch. And to get a little bit more into trapezius and levator, you're actually going to look down. It's called the thinker. You're going to gaze down towards the floor at an angle, and then you're going to stretch a little bit more levator and also some upper trapezius. And then come back here and then release it. And again, I'm not pushing on my head, I'm just letting the weight of my hand on my head create a little bit of a stretch. So again, we do that same side bend, and then we look down towards the underarm for the thinker, and then you can actually put your hand a little bit more this way and just a little bit of a stretch here, more on the top of the head forward, will then also give you a little bit more of an upper trapezius and suboccipital stretch to run through the back of the neck. And then release, and then come back to center. And then you'll want to repeat that all on the other side if you feel it on both sides. Some only feel it on one side, but it's good to do it on both just to get a gauge of what one side feels in relation to the other. And then of course it's always good just to kind of do a little bit of a forward head circle and then forward, and then repeat that to the other side. Look to the side, allow your head to move forward to the side and center. So we just call those half circles forward. Okay, and now next I'm going to show a little bit of a stretch for the, or not a stretch, a trigger point release for the upper trapezius. Now this is if you have two racket balls or pinky balls. You could use lacrosse balls. Those tend to be a little hard. Maybe even tennis balls would work. So I'm going to move my chair. And I'm going to lie down on the mat here. But before I do, feel the back of your neck where you feel the C7 vertebrae. It's the sticky outy bone right at the base of your neck. You're going to place the two balls a little below it and then apart slightly. So you're going to want to have them about here. And this usually tends to be a pretty good trigger point release area. But you can always move them around a little bit if you need to. And then I'm going to lie down on my back. Hopefully you can see me. And the balls are just going to stay there, and you may not feel a lot at first. Usually most people say, well, I don't really feel much there. However, if you put your hands together, clasp them, make sure the heel of your hand is together and reach your arms up. And if you slowly bring both arms back behind you, those trigger point balls are going to dock up into the flesh of your trapezius, also hitting a little bit of levator probably too. And you're going to feel a little bit of trigger point release or pressure as your arms go back. Now to increase that, you can bridge your hips up as you pull, lower your arms behind you, and that's going to increase the pressure of those points into the balls and then slowly back down. And I would encourage you not to do more than 3 to 5 reps of each of these, just kind of moving slowly through them. We don't want to grind and keep digging in there. It's just a little gentle release. And then also you can make what I call genie arms, and you can just move your genie arms behind you and then forward a couple times, and then you can progress these into what we call genie circles, genie arm circles. And again, feel free to move them down a little bit, a little closer together, apart. You really can't go wrong. It's very gentle, but what you'll notice is that when you sit up, after you've done that, you should be able to feel a little bit more of a release in your neck. So you could try to do these maybe before your mat class to help you feel better through. And then if you feel a little bit of tension through scalenes, SEMs, upper traps, you could always repeat this after your class. Just remember, follow your body, listen to it, don't be pushing through it so it's really hard, just gentle. The neck is a very, very important part of the body, but full of muscles. It's supporting the head, and we want to treat it gently and with TLC. Okay, thank you.